Another day, another video of first aid by. Find a quick way to OTC medicine for vomiting. First aid by. Vomiting can be an unpleasant experience, and it's important to find the right remedy to help you feel better. Over-the-counter, OTC, medicines are available to help reduce the frequency and intensity of vomiting episodes. This video will provide information on the different OTC medicines available for vomiting, their potential side effects, and how to use them safely. There are several over-the-counter, OTC, medicines that can help relieve vomiting. Here are some quick options. Bismuth subsalicylate. Bismuth subsalicylate is an over-the-counter, OTC, medication used to treat nausea and vomiting. It is typically taken by mouth as a tablet, chewable tablet, or liquid suspension. Bismuth subsalicylate works by coating the stomach, which helps reduce vomiting and nausea. It also helps to reduce inflammation and irritation in the stomach. Bismuth subsalicylate is generally safe and well tolerated. However, it is important to speak with a doctor before taking this medication, as it can interact with certain other medications. Dramamine. Dramamine is an over-the-counter, OTC, medicine used to treat symptoms of motion sickness and nausea. It is used to prevent vomiting and dizziness caused by motion sickness. It can also be used to relieve nausea and vomiting caused by other conditions such as chemotherapy, radiation therapy, or pregnancy. It works by blocking the action of a certain natural substance in the body that helps control nausea and vomiting. It is available in various forms, including a tablet, chewable tablet, liquid, and rectal suppository. It is important to read the label carefully and take the medicine as directed. Meclizine. Meclizine is an over-the-counter, OTC, medication used to treat nausea, vomiting, and dizziness due to motion sickness. It is an antihistamine, meaning it helps to reduce the symptoms of allergies and other histamine-mediated conditions. It works by blocking the action of histamine in the body, thus preventing the symptoms associated with motion sickness. Meclizine is generally taken before travel to help prevent motion sickness, but it can also be taken after the onset of symptoms to help reduce them. It is available in both tablet and capsule forms and can be taken with or without food. It is important to follow the directions on the packaging when taking meclizine and to talk to a doctor if any side effects occur. Emetrol. Emetrol is an over-the-counter medicine that is used to treat vomiting. It works as an antiemetic, which means it helps to reduce nausea and vomiting. It is a combination of two active ingredients, dextrose and phosphoric acid, which work together to reduce the feeling of nausea. Emetrol does not cause drowsiness or interact with other medications. It is an effective and safe way to treat vomiting without the side effects associated with other antiemetic medications. It is available in liquid and chewable form and can be taken orally or via an IV. Antiemetic drugs. Antiemetic drugs are a type of over-the-counter medication commonly used to treat vomiting. They work by reducing the effects of chemicals in the brain that cause nausea and vomiting. Common antiemetics include Dramamine, Bonini, and Emetrol. Most antiemetics come in the form of tablets, capsules, or liquid. Some are also available as patches. It is important to follow the instructions on the label, as some of these medications can cause drowsiness. It is also important to talk to a doctor before taking any medication, especially if it is for a child. Ginger. Ginger is a popular over-the-counter, OTC, medicine used for treating vomiting. It has been used for centuries as a natural remedy for nausea and vomiting. It is known to contain compounds that can help reduce inflammation and fight off infections. In addition to its anti-nausea properties, ginger is also believed to relieve motion sickness, morning sickness, and other forms of nausea. Ginger can be consumed in various forms including capsules, tablets, or tea. It should be noted that ginger should not be taken if you are pregnant, as it can induce contractions. Additionally, ginger should be taken in moderation, as consuming too much can cause stomach upset. Antacids. Antacids are a type of over-the-counter, OTC, medicine used to treat symptoms of vomiting. They work by neutralizing stomach acid and providing relief from stomach upset. Antacids are generally safe for adults and children over the age of 6 when taken according to directions. Common antacids include calcium carbonate, aluminium hydroxide, magnesium hydroxide, and sodium bicarbonate. Antacids are most effective when taken shortly after vomiting occurs, as this will help to reduce stomach acid levels and prevent further irritation. If symptoms persist or worsen, it is important to speak with a healthcare provider to determine the underlying cause. Serotonin antagonists. Serotonin antagonists are a type of over-the-counter, OTC, medicine used to help treat vomiting. These medications are often used to treat conditions such as nausea, motion sickness, and gastroenteritis. Serotonin antagonists work by blocking the action of serotonin, a neurotransmitter that can cause nausea and vomiting. These medicines can be taken orally or given as an injection. Common OTC serotonin antagonists include metoclopramide, ondansetron, and domperidone. These medications are generally well tolerated, but side effects such as headache, fatigue, and dizziness may occur. Speak with your doctor if you experience any of these side effects. Dopamine antagonists. Dopamine antagonists are a type of over-the-counter, OTC, medicine used to treat vomiting. These medications work by blocking the effects of dopamine, a chemical in the brain that can cause nausea and vomiting. They are typically used to treat motion sickness, but they can also be used to treat other causes of vomiting, such as certain medications or illnesses. Dopamine antagonists can be taken orally or injected, depending on the severity of the symptoms. They are generally safe and effective, although they can cause side effects such as drowsiness or dizziness. It is important to follow the instructions on the packaging and talk to your doctor if you have any questions or concerns about using these medications. Cannabinoids. Cannabinoids are a class of compounds found in the cannabis plant that interact with the body's endocannabinoid system. Cannabinoids have been used for centuries to treat a variety of ailments, including nausea and vomiting. Recently, studies have shown that cannabinoids can be an effective treatment for nausea and vomiting caused by chemotherapy, radiation therapy, and other treatments. Cannabinoids, when taken in pill form, have been found to be effective in treating vomiting, even when other treatments have been unsuccessful. Thanks for watching.